Morning. Happy Wednesday and happy April Fool's Day. And it's not an April Fool's joke that we're continuing to practice our physical distancing protection to help continue to stop the spread of this virus. So although a lot of people find that annoying and difficult, it's really important. One of the things that I mentioned yesterday was that I was going to spend today talking about the mental health and depression anxiety screen test that's on that website that I've been showing you. And yesterday we did the cannabis test, and today's Wednesday. So if you scored above about 15 on that test yesterday, see if you can make this a weedless Wednesday. That's a little bit of a joke, but as lots of jokes, it's not that great. Anyway, I will share this screen and we will take a look at this test. So we're going to look at the depression and anxiety screen test. And let's see, should I be a young male or a young female today? Let's go with a young female named Sue. And we'll check the box to acknowledge that this is not public information, but they're going to look at the stats. And we have not given birth in the last 6 months. Have you had any sudden period of intense fear, anxiety, or discomfort? For most people, that's going to have a degree of truth to it at the moment. So let's say yes, because the changes that we're experiencing are significant. Are you anxious about going to or being some places or situations because you fear that you will have an anxiety attack, fear that you will not be able to escape if you have an anxiety attack, fear that you will not be there if help will not be there if you need it, and feel uncomfortable? So depending on where a person is at, if anxiety is a pretty common issue, and I know if you watched last week's show, I had a video from Marina on there, and one of the issues that Marina talked about were panic and anxiety attacks that she was having and what she did to change that. So if you do have some anxiety, it's really important to understand that you can become stronger than it is. You can change that. And we'll talk a little bit about that as we go through here, but let's say yes. And do you avoid going to or being places or situations because you are afraid you're going to have an anxiety attack, fear that you'll not be able to escape, fear that help will not be there, or feel uncomfortable? And one of the big issues that people with anxiety feel is shame or embarrassment if they start to have an anxiety issue when they're in public. They start worrying about what's everybody going to think. And that makes it even more difficult for them because it just adds to the anxiety. So let's say yes again, because Sue does have some anxiety issues. Do you have excessive fear? Do you avoid social or work situations because you feel embarrassed, humiliated, or feel that people will be judging you? Let's say yes again. Do you experiencing anxiety? Try that again. Do you experience anxiety because of uncontrollable thoughts, images, or impulses that you can't control? And that's exactly what anxiety is. We start to have thoughts or feelings that we feel we can't control, and we become very afraid, and that triggers our panic stress system, and that gets out of control. So we'll say yes again. Do you do certain things or repeat certain thoughts over and over again? Do you do these things according to special rules or until it feels just right? So this is a bit of a shift. This is into obsessive compulsive thinking. This is about worrying about the same thing over and over again, constantly locking doors or checking, see if you lock the door, and then checking again to see if you lock the door, or washing your hands again. I have a bit of an issue with my locking my car, my truck. I walk away from it and think, did I lock that? I might be being old, but I always check it again. And if I don't check it, then I think about it. So we're going to say yes to that one too. For the past 6 months, have you been worrying constantly or excessively about several different things? For example, school, work, family, finances, or health. Let's say no to that one. And have you experienced or seen a traumatic or terrible event, including death, serious harm, or threat of death to you or someone else? We'll say no to that because Sue hasn't experienced any particular trauma. But that's an interesting question because that starts to lead whoever is analyzing this test to look at perhaps this person is suffering from post-traumatic stress disorder. And so tests like this do a really good job of helping people who are looking at the test, help the person figure out what's going on and then help to direct some treatment. For the past 2 weeks, have you been feeling depressed, sad, or flat most of the time? So Sue hasn't. She's been connecting with her friends and feels a little bit down once in a while because of the changes, but not particularly. For the past 2 weeks, have you lost interest or pleasure in things that you usually like to do? And again, we're going to say no because Sue is still trying to stay engaged with her life. She's still trying to find stuff to do. She's still connecting with her friends. She's doing a little bit more writing. She's doing a little bit more drawing. She's listening to music that she likes. So she's still fairly engaged in what's going on and doesn't feel down. For the past 2 years, have you felt depressed, sad, or flat most of the time? And again, we're going to say no because Sue has been, busy with stuff and doing fairly well. Has there been a period where for 4 days or more you felt really good, high, hyper excited, energetic, invincible, confident, or powerful? And during this time, did you feel that you could do anything you wanted and nothing could stop you? People may have said that you weren't yourself and you may have gotten into trouble. So that question is directing towards bipolar disorder or what used to be called a manic depressive disorder. And again, for Sue, we're going to say no for that. But if that's true for you, if you get, a few days in a row where you're just wildly excited about stuff and you've got tons of energy and you can do all sorts of things and your mind's racing, that's a sign that there may be a bigger issue the matter. Has there been a period where for 4 days or more you felt extremely irritable, mad, angry, disruptive, or aggressive? And during this period, did you talk louder than usual, shout at people, start arguments or fights? Other people may have said you weren't yourself and you may have gotten into trouble. So again, what that's looking at is those significant mood changes that are often a part of bipolar disorder. And again, for Sue, we're going to say no. And then we're going to click to a different screen. So according to previous responses, you have had a sudden period of intense fear, anxiety, discomfort, also reported fear and avoidance of places, situations, because you were afraid of having an anxiety attack, fear you would not be able to escape if you had an anxiety attack, fear that help wouldn't be there because it makes you feel uncomfortable. So these tests take a look at what you answered in the first section, and then they start to become a little bit more specific. Did your first anxiety attack catch you by surprise? Was it unexpected, or did it seem to happen out of nowhere? So let's say yes, like, oh my God, what's happening to me? And have you had more than one? Yes. I know one of the kids that I worked with at one of the schools would have anxiety attacks when the hallways were too full. And the first time it happened, it totally panicked her, and she actually fainted. And then that issue became worse because of the fear of that happening again. And we actually instituted a pretty interesting meditation program with her that really helped her regain her confidence. So the one thing that you need to know about all of this stuff is that it is treatable. And it's really important to talk to somebody who can help you. There's lots of self-help stuff on YouTube, but having a discussion with a professional about this stuff is also very, very useful. Because the worst part of the anxiety attack usually lasts between 10 and 30 minutes. Yes, they're usually relatively brief. And it's also interesting, and I didn't talk about this much yesterday, but one of the things that cannabis can cause with people is anxiety issues. I was talking to a fellow the other day who stopped using cannabis because he realized it was making him anxious and paranoid all the time. Number four, we spent a month or more worrying about having an anxiety attack or what might happen if you had another one. So again, if you've had a couple or more, that is going to be something that's on your mind because they're frightening. Think back to your last bad anxiety attack and check the symptoms that you experienced. Most people will notice that their heart feels like it's beating faster, shortness of breath or trouble breathing. Most people will get sweaty or clammy hands, but they don't notice. Chest pain or pressure or discomfort is a common issue. Lots of people end up in the hospital thinking that they're having a heart attack when they're actually just having an anxiety attack. And let's check dizziness and lightheaded. Sometimes they cause stomach issues. Feeling of being attached or outside of your body, or feeling that things around you were strange, weird, unreal, or unfamiliar. That's a fairly common issue with panic disorders. It's almost like you're trying to escape yourself. But that didn't happen to Sue. She did think that she was feeling like she was losing control, and she did notice that she was having chills, like she felt cold. So we'll go down a little further. Have you had 6 or more anxiety attacks in the past year? And for Sue, we're going to say no. Have you had 2 or more in the past 2 weeks? And again, we're going to say no. How much do your anxiety attacks interfere with your normal daily life? And we'll go considerable here because it's something that she worries about. Although they don't happen all the time, it's always in her mind that, oh my God, what might happen? Which situations do you avoid because of fear or discomfort? Then the first section is transportation. We don't have trains or subways or streetcars. And let's just go with buses because she doesn't like going on the bus because there's too many people. Public places, auditoriums or stadiums, and theaters, and sometimes classrooms. It was bothering her in classrooms a little bit, particularly if she wasn't sitting near the door. One thing that I often suggest to people who are having anxiety issues that involve lots of people is make sure that you sit on the end of the row and near an exit, because that gives you a little better escape route. And crowds were an issue for Sue. She wasn't worried about enclosed spaces so much, and she wasn't worried about open spaces so much. It does bother her when she's standing in line. She starts to worry that maybe I might have an anxiety attack and then people are going to look at me. She's not worried about any of those things. And if you selected any of the above, how much does your fear avoidance interfere with your normal daily life? So with Sue, we'll say moderate because it does make her a little bit uncomfortable going into situations, and then often she won't go or will have difficulty going. And she doesn't feel awkward in social situations. And what situations do you fear or avoid because you feel embarrassed, humiliation, or judgment? So speaking or performing in front of others, not particularly dealing with people in authority, not particularly. She is bothered by talking to strangers. Social gatherings don't bother, dating situations don't bother, being observed by working doesn't bother her. And it does bother her a little bit being the center of attention. So I'll tell you something quick about me in relation to this. I have a really bad habit of saying when I'm thinking and trying to talk at the same time, as you've probably noticed. And I have been trying very hard to rid myself of that habit. And so even though I spend most of my time talking about stuff, occasionally it's a little bit uncomfortable for me because I start thinking, am I going to do that again? So I'm practicing that. If anybody wants to keep score, you can listen to this again and keep track of how many times I said while I was doing this video. Number 3, does your fear avoidance of the above situations interfere with your normal daily life? Mild, some interference. And we'll click to the next one. According to your previous responses, you experienced anxiety because of thoughts, images, or impulses. Blah, blah, blah. Do these thoughts, images, or impulses seem intrusive, strange, or inappropriate? No, they're just uncomfortable. Do you try and resist or ignore and suppress these thoughts? Yes. Because we know that how we are feeling is based on how we're thinking. If I've done nothing else over the last week and a half of these videos, I've been trying to pound that thought into everybody's head, that we really have the power to control how we feel if we pay attention to how we think. Are you able to resist, ignore, or suppress these images or impulses? Yes, most of the time. And what general themes or thoughts? What are the general themes of your thoughts, images, or impulses? And harm to self or others? No. Sex? No. Contamination, germs, disease? That could be true at the moment. Making decisions could be too. Should I do this or do that? And checking means that we keep checking what we're doing over and over again. How much do these thoughts and impulses, images interfere with your normal daily life? Mild and some. And check what you do over and over according to special rules until it just feels right. And really the only thing is checking locks, doors, and stoves. The last one on that, number 6, is saving, collecting, and hoarding. If you were out buying voluminous quantities of toilet paper, you might want to check that too. Number 7, how much do the above interfere with your normal daily life? Mild and some. And we'll go on to the next screen. Hopefully we'll go on to the next screen. They're generating our report. So again, you can email this to somebody. If you do have a therapist or a doctor that you're working with about these issues, you could certainly send them to that. And again, I'm always interested to see where people are at. If you did score high on this at all and you would like some help with this, please send that to me and I can suggest some possible treatments that you could start to employ at home. Meditation, exercise, mindfulness, those kinds of things are very helpful. Also, gratitude lists are pretty useful too. So Sue has reported a number of symptoms of panic and euphoric fear and avoidance. So she has experienced at least one sudden period of intense fear and anxiety, uh, seemed to happen out of nowhere, had more than one anxiety attack, reports that they last between 20 and 30 minutes, and then they go through the symptoms again. And basically the ones that she said yes to. And so again, that's indicating that Sue could get some treatment for this. If any of that stuff is true for you, please check with somebody that you feel would be a helpful resource for you. And we'll see if this can help people recognize why they're feeling uncomfortable. And like I said, the current situation that we are in is highly charged with possibilities for feeling all of those things. So remember, much of these mental health issues, particularly anxiety and depression at the moment, are situational. If you're feeling uncomfortable about a lot of things, and this is relatively new for you, it's likely because lots has changed. If this stuff has been around with you for a while, then certainly it's worth getting some secondary help for. If it's stuck with you and nothing's changing, then what you're doing isn't working. And if what you're doing isn't working, continuing to do the same thing isn't particularly useful. So, as in all things, if you're struggling with something and you don't quite know what to do, please ask for help. So I will see you all tomorrow. Hope you enjoy this. Tomorrow I've got a new video from a young woman who contacted me about some of the stuff that she's done. Sorry, I thought I clicked the wrong button. Self-confidence is always an issue. I've got a video tomorrow from a young woman who contacted me about some stuff that she'd done to repair her mental health situations. It's very interesting. So hopefully you'll check this out today and be back tomorrow. Thank you.